In this video, we'll be demonstrating how WD helps the clinician write a fast, expressive, and complete medical note. Let's fill out a severe malaria checklist. This shouldn't take more than a minute in practice, but of course will take a little extra time for the purposes of explanation. Ruben is sick. He's had a history of cyclical fevers. He's been confused for a few days, and as a result, he has not been drinking. Of course, one cannot get severe malaria unless they live in or have traveled to a place where P. falciparum is endemic. Turns out that Ruben has traveled to Liberia. Visual decision support confirms that Liberia lies in a P. falciparum zone, as depicted here. You may see that as we have clicked on the history elements to the left, the medical note on the right has been changing. In the WD system, the patient history and exam is initially written in the negative, as if the patient is completely healthy, but positive findings in the checklist erase the healthy elements in the medical note. This is a key feature to WD's quick note writing feature. This does mean that the clinician must be complete with their questioning. For example, the current documentation still says that Ruben is breathing normally, that he maintains a urine output and hasn't complained of abdominal pain. If this is not the case, the user simply edits the incorrect finding to the correct one. So let's make Ruben breathe fast. Let's decrease his urine output. Let's look carefully at this substitution feature as we fill in the exam section. On exam, the patient is lying down immobile and won't get up, but the medical note currently registers a well-appearing patient. But when we click on prostration, prostration is entered as a pertinent positive, and the previously well-appearing part of the exam goes away. Similarly, the patient's mental status is not normal, but the exam currently lists him as cooperative and oriented. Clicking Change in Mental Status places it as a pertinent positive, and the findings of cooperative-oriented patient go away. Finally, let's say Ruben is pale from hemolysis, but the exam currently states that Ruben is of normal color. Clicking Pale places it as a pertinent positive, and the normal color finding of Ruben goes away. In the WD system, the medical note is not limited to checklist content. The provider can record additional historical and physical elements. To do this in a physical exam, the clinician simply goes to the system of concern. Let's say Ruben has hepatomegaly, so we go to the abdomen. We find the liver part of the exam and register a large liver, specifically by noting how many centimeters it is below the right costal margin. Let's say 8 centimeters. This method also allows for entry of clinician observations such as liver consistency normal. Let's say that in addition to Ruben breathing fast, that he has retractions. One would just go into the lung section, enter in retractions, and describe them as, let's say, severe and suprasternal. Again, one can enter in notes, accompanied by loud sounds. The end result is clear, elegant display of the provider's physical observations outside the checklist entry system. Similarly, the provider can add to the history outside the checklist. We already talked about one way of doing this, edit to a common review of system box. Another way is to manually enter a symptom in the add complaint box, shown here. Let's say the patient has been vomiting blood for 2 days intermittently. The user can record this as vomiting, select, enter in severity. Let's say it's been severe, but it has been intermittent for 2 days. And we'll enter in the fact that there has been some blood noted in the vomitus. Whether in the history or exam, most WD users do not feel the need to work outside the checklist, as it is constructed to be simultaneously comprehensive and focused. Yet WD leaves it up to its users to choose their preferred documentation style.